Another Hollywood celebrity is using her platform to raise awareness about breast cancer. We're talking about Olivia Munn here, an actress and model. She revealed over the course of the last year she was diagnosed and then underwent a double mastectomy despite having a clear mammogram 2 months earlier. WRAL health reporter Grace Haba shares the tool Munn's doctor used that helped identify the disease.
The breast cancer risk assessment score, also known as the Gale model, is a tool doctors use to help determine if a patient is at a higher risk for developing cancer, even if, like in the case of Olivia Munn, their mammograms are coming back clear.
The tool considers a patient's age, race, when they started menstruating, if they've had any kids, family medical history, known gene mutations, and past biopsies to calculate the probability of developing breast cancer.
I always like to put it in the context of, well, what's your risk compared to, say, the average woman? Because that's really where it helps us decide, do we need to do anything different?
That's what actress Olivia Munn shared happened in her case. In a post on Instagram this week, the 43-year-old mom shared her risk assessment score was 37%. That led her doctor to suggest a breast MRI, which eventually led to the discovery of an aggressive type of cancer in both breasts. Dr. Jennifer Plichta with Duke Health explained breast MRIs can detect more than regular mammograms, but one usually isn't prescribed right away for most patients.
They're more likely to find cancer, more likely to find it at an earlier stage, so they can be a really great test. The biggest downside to MRI is they're a really sensitive test, so they're really good at finding things, but they're not good at telling us what those things are.
She explained breast MRIs can lead to more false positives and often require multiple follow-up visits and exams for patients.
It's also expensive. Insurance doesn't always cover it. I might think something's indicated, but the patient can't afford it. And that's just the reality of the world we live in today. So there are a lot of considerations that go into who should be getting MRIs and whether or not that's feasible for that patient.
Dr. Plichta says she typically considers a breast MRI as a good next step for patients with a risk assessment score over 20%. Grace Haba, WRAL News.
Now, according to the Susan G. Komen Foundation, breast cancer found in its early and localized stages has a 99% 5-year survival rate.